I'm really excited to bring these live sessions to you in the hope that it provides better insight into the life of someone living with misophonia, tinnitus, and hyperacusis. Each month, we'll be exploring a different topic within sound sensitivity, aiming to give you a broader comprehension and understanding of these conditions. We will be exploring different techniques and management skills in this programme, being joined by experts in the field who will be sharing the wealth of knowledge in these areas. We will be shining the spotlight on other related audiological conditions, such as balance problems and how patients can self-manage these. We will be joined by patients themselves who have a deep understanding of how misophonia, tinnitus, and hyperacusis affect every part of daily life. I will be asking them to share with us how we have navigated challenges and life events with these conditions and what they feel helped them along the way. And there'll be the opportunity for you to ask our experts, healthcare professionals, and lived experience patients any questions too. Today we have Irini, a research psychologist at Greater Manchester Mental Health NHS Foundation Trust. Irini has a research interest in physical and mental long-term conditions and stress psychotherapeutic therapies on individuals' quality of life, and has a master's degree focused on health medical psychology from the University of Nottingham. I'd like to hand over to you now.
Amazing. Thank you so much, Joanna. I will share my screen very quickly before I start with my presentation. Thank you for the introduction, and of course, thank you for the invitation. I couldn't be happier for having this opportunity to share my knowledge with you and the community. So I'm just, can you see my screen? Joanna? Yeah? Can you hear me? I'll take this as a yes. Well, so just to echo on everything that Joanna said, I am a research psychologist. I have been doing research the last 6 years for psychotherapy services across Greater Manchester, and I focus on improving access and engagement with psychological therapies, as well as improving the outcomes of clients that receive any type of psychological therapies. I also have misophonia myself. I had my first memory of having misophonia when I was 8, and I self-diagnosed myself when I was 23, a couple of years later, which made me very happy because I realized that I'm not just difficult. I do have something that exists and other people suffer from. So I'm very excited that I managed to actually reach out to University of Newcastle and have the opportunity to also do some research for a couple of years with Professor Kumar, who did some research neuroimaging, basically. I'll expand a little bit further later on. I also have Sol, my dog, who has also some sort of sound sensitivity with the lift. So in case you hear him barking, please kindly ignore. I've tried my best to train him, but he's still a bit vocal. So, yeah.
Oh, sorry, Irini. Are you able to press the slideshow so that we can see it via the slideshow? Thank you.
Oh, the slideshow. You mean just to make it presentation?
Perfect. That's brilliant.
Perfect. Sorry. I thought you could see that. Sorry. No worries. I hope you can hear me well as well. So, as an overview, what we're going to cover in this session. So I will briefly describe the 3 conditions that we're focusing on: hyperacusis, tinnitus, and misophonia. And I will try to highlight some key similarities and differences amongst these 3 conditions, so we better understand what each condition consists of and what is the prevalence in the population. I will then move on with focusing a little bit more on misophonia, due to the fact that I have been focusing a little bit more on misophonia research rather than hyperacusis and tinnitus. So I will share with you a misophonia experience, and I will try to explain in very simple words how the misophonic brain actually works and why we do have those misophonic responses. After that, I will try to cover some options as regards to how to cope and what therapy options are out there. And driven by my research in psychological therapies, I will try to communicate the 4 steps for successful therapy. So how to actually increase and enhance your engagement with therapy and see the most benefits out of it. Last but not least, I will invite you to join me in a breathing exercise, in a 3-minute breathing exercise. Of course, it's optional. You don't really have to do it if you don't want to, but I thought it would be a nice way to close this session. And after that, Q&A will follow, and I will be more than happy to respond to your questions, either related to the presentation or in general. So starting off with hyperacusis. So hyperacusis is a condition that is characterized by an increased sensitivity to everyday sounds, making normal environmental noises seem unbearably loud. That means that people with hyperacusis may find typical sounds like conversations or traffic sounds or household noises intolerable, even painful. Hyperacusis is quite rare, as it affects about 2 to 3% of the population, and is quite common amongst people who also have tinnitus or hearing loss. Tinnitus, on the other hand, is the perception of a sound in one or both ears. As far as I know, it's more common to have it only in one ear when no external sound is present. So basically what happens is that the person who has tinnitus has a ringing, buzzing, or a whistling type of noise, and that noise can vary in pitch and severity, and also it can be continuous or intermittent. Tinnitus is a little bit more common amongst the population, with 10 to 15% reporting symptoms of tinnitus. And last, we have misophonia. Misophonia is a condition where individuals experience strong aversion or strong emotional reactions, such as anger and disgust, in response to a specific set of sounds. Often those sounds are quite soft. They're produced by the mouth or the nose, including coughing, breathing, swallowing, chewing, etc., or can be just soft repetitive noises like clicking, barking, etc. The intensity of emotional response can vary depending on the severity of misophonia, and it seems, although we don't really have too much research going on as regards to the prevalence of misophonia and how common it is estimated to be between 6% to 20% amongst the general population. Moving on to the key similarities, I'm going to state the obvious as of the first similarity, that all 3 conditions basically involve a heightened or an abnormal response to sound. And the second similarity is that we do see an overlap between these 3 conditions, especially tinnitus can be often co-occurrent with misophonia and hyperacusis. It's not that common to see people with hyperacusis to have misophonia. And last but not least, the most important one, all 3, each condition can cause a significant distress, leading to difficulties in daily activities, work, and social interactions. Basically, emotional responses such as distress, irritability, anxiety, extreme vigilance are quite common in all 3 conditions that may lead to more severe mental health issues like generalized anxiety or depression. Moving on to the key differences. The first key difference I would say is the perceptual experience. What is very interesting here is the different impact that sounds have in each condition. So in hyperacusis, what we see is that the perception of the high volume is what creates the distress. So we're talking about, we're focusing on the volume, although the sound is in a normal level. The person with hyperacusis has perceives the sound as loud. Then we have tinnitus, where the sound actually doesn't exist in the external environment, and it basically lives in the person's brain who has tinnitus. So we're talking about phantom noises. It has nothing to do with how loud that is. It has to do with the fact that it's actually in your brain quite often. And then we have misophonia, which is a specific set of sounds that create that response, and it has nothing to do with how loud those triggers are. It's clearly just those set of sounds. The second difference is the emotional versus physical distress. So basically, what happens in hyperacusis, the person who has hyperacusis has a difficulty hearing those sounds because they are very loud. So we're talking about a physical impact on someone's hearing, in contrast to misophonia, where there is an involuntary emotional response towards the sound. It has nothing to do with actual having a physical impact on someone's body. Tinnitus, on the other hand, is quite distinct because we're talking about a phantom sound that lives in your brain. So it creates an internal distress due to the fact that it's a constant sound that probably doesn't allow you to feel calm and in peace. Third, and very interesting difference is the underlying cause. All three conditions, I would say, they are a bit under-researched, especially misophonia, that is very newly introduced in the research field. So both hyperacusis and tinnitus, of course, Joanna has a little bit more insight into that. My short research showed that basically in those two conditions, we do have an external factor actually contributing to these conditions. So exposure to loud noises, damage in the auditory system can lead to either of those conditions. In contrast to misophonia, which we have not really a good idea as to why misophonia exists, but we do know that it has nothing to do with an external factor. It is basically more like how the brain processes those sounds, and the age of onset is usually in childhood or early adolescence, in contrast to hyperacusis and tinnitus that can happen anytime during your lifespan. So, moving to a little story. It's an imaginary story, but it is something that can happen. Anyone who has misophonia will probably relate to that story. We have the story from Mary, who is in her 20s, and she is bubbly, has a bubbly personality, extroverted. She works in marketing, and she also has misophonia, with the most common triggers for her being slurping, swallowing, and chewing. So Mary has been invited to her family Christmas dinner that she was very happy to attend, but of course she was vigilant of the trigger sounds that she would be exposed to. In addition to that, she was sat next to her beloved granddad, who has been missing some teeth. So the granddad would make extra noise whilst eating. And then the first course was also soup. So all together, they started slurping the soup as like a slurping concert. And then Mary, unfortunately, was trying to fight down the emotional responses she was feeling, but unsuccessfully so, because she lashed out at some point. She yelled at her granddad to stop, and she just left the room. She stayed in her bedroom until the end of the dinner. Of course, that brought a wave of reaction from the family. They couldn't understand why Mary was so rude, why Mary would react like this, why would she ruin the Christmas holidays. So the emotional impact has been different to each participant in this family dinner. We have the granddad, of course, who doesn't understand why Mary yelled at him, and he, of course, felt quite sad for making Mary angry and a bit confused as well. Then we have the mum, who felt quite angry and offended since she put all her effort to make this dinner and have everyone over, and then she doesn't understand why Mary, her own daughter, can become so angry at her. And then, of course, we have Mary, who unfortunately feels all of the above, plus some guilt, some disgust, some desperation, due to the fact that she doesn't even understand what's going on. So what's going on is quite complicated, but I will try to make it quite clear in a nutshell. Thankfully, in 2017, we had the first evidence on why misophonia is something that happens in the brain. So there are some brain structures that belong to a network called salient network. So the salient network, the core function of it is to detect and select emotionally salient information. So what happens, misophonic cues are considered highly salient by misophonic patients, which means that we do see a hyperactivity in salient network in misophonic patients when we compare the salient network activity with non-misophonic people. Similarly, we do see a hyperactivity in the amygdala. The amygdala is also very central to the detection and the interpretation of emotional stimuli, particularly fear and threats. So what we see here is that when a misophonic person is exposed to a misophonic cue, the amygdala basically tells the person that this is a threatening event. And what does it do? It activates the autonomous nervous system. So the autonomous nervous system is central in this case. And the reason why is because this is the system that controls all the involuntary bodily functions, including your heart rate, your digestion, your blood pressure, your breathing, etc. It's also responsible for the fight or flight response. So as the name says, it's autonomous. You don't tell your heart to beat, you don't tell your lungs to breathe. It's the same thing with a fight or flight response. So since there is this array of events, we have an activation of our fight or flight response when exposed to misophonic cues. And that is what creates Mary's reaction into anger and then fleeing the room, like the situation, so removing herself from the room. So this is something that happens involuntary. It's not something that someone who has misophonia is able to actually control. However, and because I want to be very optimistic here, what we can do is we can regulate our feelings and we can help our heart to slow down. We can help our brain to slow down as well and not give in the immediate effect of the trigger sounds. So first and foremost, we have some practical coping mechanisms. Earplugs are my best friend. I always carry earplugs with me and I always have my noise cancelling headphones. This is purely a practical way to protect yourself in case you're in an environment where you can't really leave. So for example, if you're in a train and someone eats crisps next to you, well, you can't really do anything about it because it's a free country. Everyone can eat whatever they want to eat, but it's your responsibility to protect yourself from this so you have a better experience. Besides the practical recommendations, of course, we do have some promising evidence that therapy works for people with misophonia, specifically cognitive behavioral therapy. So interventions that involve CBT are mainly concentrated on the preoccupation of the individual with misophonic triggers. If we take into account the fact that hyperfocus is considered one of the main symptoms of misophonia. Also, interventions target the associated negative response by overwriting, so reframing this and examining underlying assumptions. So CBT interventions seem to be really beneficial, and from the existing evidence, there is one randomized control trial, which is a very robust way to explore the impact of an intervention. That randomized control trial showed that the group of people with misophonia who received CBT, in comparison to the group of people who didn't receive CBT, received basically nothing, and both groups had misophonia. The group that received the intervention showed 37% of symptom reduction. And even more interestingly, that reduction stayed over time. So after 1 year, even 1 year later, people still had a reduced symptomatology in relation to the people who had no CBT. So that, of course, is a great outcome. It's something that really enhances the idea that receiving CBT can be very, very helpful. Last but not least, we have mindfulness. Mindfulness techniques, of course, may assist in creating psychological distance from negative thoughts, and they also involve some breathing exercises that, as I mentioned beforehand, they are very useful to regulating your heart rate, and hence you have some general regulation of your fight or flight response. Moving to the steps for successful therapy. So these are 4 steps to engage, but also see the most benefits you can have from therapy. The first step, I would say, is motivation. So motivation could be not only the idea that going to therapy is something important for the individual who takes this step, but it's also the idea of believing that change can take place and being motivated to engage to the process. And part of that will, what will help with motivation is setting realistic expectations with it, which is step 2. And so what happens basically is that recovery from sound related conditions may take time, and the progress is not a linear process. It's basically gradual, and it has its own setbacks. So having realistic expectations and being able to identify small achievements is what will feed motivation and will keep you engaged throughout treatment. Thirdly, we have active involvement. So active involvement entails good communication with your therapist, practicing the skills that you've learned during therapy, and of course, keeping an open and honest mindset, being able to communicate to your therapist what works for you, what doesn't work for you, so they can make adjustments for your own sake. Also, it's very important to set goals together and create a relationship where you can both reflect into what is helping you and what is not really that helpful. In general, research has shown that the therapeutic relationship is very, very important for a successful outcome. So keeping being honest and asking any questions will really help the therapeutic experience to be at its best. And lastly, we have self-care practices. So this is very important throughout your therapy course, but also after your therapy course, it's really important to have 3 things in mind: sleep, diet, stress regulation. The reason why these 3 are very important is because if you suffer from one of those 3 conditions, at least for misophonia, I know that if you are sleep deprived, if you are stressed for any reason, your misophonic response will be worse. And the reason why is because, as we mentioned earlier on, the autonomous nervous system is already a bit loaded. So being exposed to misophonic trigger, it makes you even more agitated than you would be if you were well rested. So it's very important for sleep to have a sleep routine that works for you. For example, no screens an hour before bed, no light half an hour before bed. In general, try to sleep more than 8 hours. That's in general good for your brain health. Then we have diet. Of course, consumption of a lot of sugar or processed food can lead to energy crashes. That will lead you to be a little bit more vigilant, a little bit more irritable if you are exposed to misophonic triggers. And then we have stress management. That includes breathing exercises that we will see in a minute, and also yoga practices, going to the gym, exercise in general really helps with stress regulation. That could really help with how the condition interacts with your body. So now I'm gonna in a minute I'm gonna describe what is gonna follow. We're gonna do a breathing exercise, which is gonna last 3 minutes. It's a very short breathing exercise, and I just want to show you how easy it is to integrate a 3-minute exercise that will help you regulate your heart rate, and you can do anytime, maybe after you wake up, before you go to bed, before a meeting, after a meeting, etc. So I'm gonna guide you through it. I'm gonna count 4 to up to 4 for your inhale and up to 6 for your exhale. Usually exhales are longer because exhales are what instruct the heart to slow down. So exhaling is always helping for your heart to slow down. Inhaling is what makes heart go faster. So that's why we'll count to 4 for the inhale and we'll count to 6 for the exhale. So I will now like to ask you to close your eyes if you feel comfortable, or soften your eyelids. Find a comfortable position in the chair that you are sitting on, and take a deep breath from your nose and exhale from your mouth. A big breath from your nose, big breath out from your mouth. And now I would like you to only inhale and exhale from your nose as slow as possible. Inhale for 1, 2, 3, 4. Hold. Exhale for 1, 2, 3, 4, 5, 6. Breathe in for 1, 2, 3, 4. Breathe out for 1, 2, 3, 4, 5, 6. Breathe in for 1, 2, 3, 4. Breathe out for 1, 2, 3, 4, 5, 6. Breathe in for 1, 2, 3, 4. Breathe out for 1, 2, 3, 4, 5, 6. You can now open your eyes. Welcome back. Nice to see you again. Hope you feel a little bit calmer than you were when you just entered this session. And I would be very happy to listen to your thoughts or any questions. And I really like to thank you for listening.
Thank you so much. That was brilliant. That breathing exercise is perfect. It just, as you said, goes to show that you can implement something like that. So such a small thing, but it actually, we lead such busy lives and we think that we can't fit these things in, but actually 3 minutes isn't a long time, is it?
Not at all.
So you're discussing obviously how stress massively impacts misophonia. I'm just waiting obviously to see if anybody has any questions on the live chat. That's brilliant. If you just pop them in, I can ask it Irini. But just thinking about obviously how stress impacts misophonia, do you think that oh, Irini, can you stop the screen share for me, please,
Oh,
on
yeah, of
the
course.
amazing, thank you. Um, do you feel, obviously, we know that stress can impact misophonia. Do you feel that depression can cause misophonia?
Well, I wouldn't think that when you say cause, you mean create the condition or to just exacerbate its effects.
Do you think it could actually create the
Create the
condition?
condition. If I'm honest, I wouldn't think so. So the reason why I'm saying this is because the onset is quite early in a young age and is usually potentially more about the relationships rather than the emotional state of the person who has misophonia. So, depression is characterized by low mood and, um, you know, um, not you're not anxious when you are depressed. You're more like in a lower state. Whereas misophonia involves a lot of vigilance, so it's not something that I can see an association with. It's more associated with anxious states rather than depressive states.
Yeah, of course. And
Mhm.
looking at sort of other mental health conditions and misophonia, obviously we know that there's quite a link between neurodiversities and misophonia. Do you think are there any similarities between or similarities or differences between misophonia and OCD?
Well, there has been, as you mentioned, OCD and ASD, being on the autistic spectrum disorder, like having autism, these two are the biggest candidates for having along with misophonia. Just to explain the reason why, autism does have as one of the symptoms, let's say, of autism is sound sensitivity. So it makes sense to think that these two are associated. OCD, on the other hand, does have some compulsive reactions. So that's another reason why we thought there could be an association. Nevertheless, there is no research because it has been researched specifically if there is an association. They haven't found any significant associations between these conditions. So it might be the case that you have both, but it doesn't seem to happen, the one happening because of the other. So, yeah,
Do
I
you
think.
feel that it's there's some of the similarities in the behaviors are do you feel that there are similarities between the behaviors between OCD and misophonia? For me, when I see patients who have both of these conditions, a lot of it is like control over the environment. Obviously, I don't know a huge amount about OCD, but it seems to be that's a similarity. Do you feel the same?
Well, there can be a similarity as regards to the compulsion. So when you have OCD in psychotherapy, um, someone who is a clinician has told me that OCD is one of the most difficult conditions to treat in psychotherapy. And the reason why is because it's quite difficult to control the compulsion. It's so similarly, as we explained the reasons why it's quite difficult to control the compulsions that comes from misophonia. And the reason why is because the brain is heavily involved. So it has to do something with learning sometimes, because the brain, the more you feed something, the bigger the area that is involved is growing more and more and more. So OCD and misophonia are basically, with your behavior, you're feeding back on this behavior as being important. So this is where I can see some sort of similarity, being very difficult to remove that learning, that condition between the sound and the emotional response, which is similar with OCD, where there is a perception, a cognitive, let's call it, is it a cognitive mistake? Like where you think that if you do X, Y will happen. So this is the conditions that they are heavily rooted in your brain that probably it's difficult to resolve.
Okay, thank you. We've had a question on the live chat from Howard Willens. He says, thank you for the presentation. It was brilliant. He says, I find it difficult to exhale slowly through the nose. Can you exhale through the mouth and purse lips to prolong exhalation?
Yes. Short answer, yes. And it is something, probably if I had a little bit more time, I would probably guide you a little bit more. In order to find the exhale, to exhale until 6, you can go up to 12 if you practice. What happens, what is the best thing to do is when you inhale, is to put your hands on your diaphragm and on your belly and see your belly blowing up and then removing all the air when you are exhaling slowly, slowly, slowly. So when you do that, especially as Howard said, through the mouth, this can take up to 10, 12, 15 seconds. So as slowly as you can, that would work perfectly.
Yeah, brilliant. And I suppose as well that almost gives a visualization when you're doing the action. And actually, I suppose doing the action can sometimes help prompt that memory of the exercise, especially for children. So that's a really great technique to discuss for us. Thank you. We've discussed obviously different conditions and misophonia, and you discussed some of the most important things that you feel you can manage stress. What's the best thing that you think that we can do to look after our mental health?
In general.
Yeah, in general,
In
for every.
general. Okay. Well, I have lately I have been focusing on the idea of pausing a little bit more.
Yeah,
I feel that breathing is part of this. Pausing allows you in general to be more reflective, not to be too you basically allow yourself to take time to understand what's happening instead of just reacting to whatever is happening. That is really helpful in general because it doesn't lead you to pathways of just rumination and catastrophizing and thinking, oh, this will happen and this will happen and this. So this, if you pause, you won't allow the train of thoughts that they are catastrophizing to lead you into a black hole. You will just keep some distance, becoming a little bit more slow paced. That means, I read somewhere that you can slow down your nervous system by brushing your teeth a little bit slower. You can slow down your nervous system by eating a little bit slower, by walking a little bit slower. Everything just to remind yourself, remind your face, it's okay. I don't need to be, and I'm telling you, and I can be very intense. I'm the opposite of very calm person, but it's very important to just remind yourself it's little things. It's not something big that you need to do. It's just little things to remind you that it's okay. I can take my time. I can pause before I react. So that would be my advice, I think.
that would be a great technique for some of our sort of younger patients as well. as I said before, we lead such busy lives, and we're having so many thoughts constantly and multitasking. It's a real skill to be able to do that, isn't it? Take that time to just pause and enjoy activities that we normally do on autopilot. So yeah, that's a great way to, and as you said, to look after your mental health. That's brilliant. Um, you talked about you mentioned the use of earplugs. So you use earplugs yourself?
Yes, I do. I have been using earplugs. I used to use wax earplugs, but now I do use silicones. But there are some earplugs called loop
Yeah.
that they you can use them. They are long-term earplugs. I think I have a very small ear, so I can't really sleep with them. But I would definitely recommend them because I have friends who have misophonia and they use them and they are so happy that these earplugs exist. I believe that they have done some collaborations with some misophonia institutes as well. Try
Yeah.
on.
There's some interesting research sort of surrounding earplugs and the use of sort of noise protection for patients with misophonia and for hyperacusis as well. Some schools of psychology consider these as safety seeking behaviors. And in our work in CBT, we try to sort of actually sort of limit the use of these safety
Mm.
seeking behaviors and promote the use of CBT to manage triggers. Um, what's your take on this as earplugs as a form of avoidance? You obviously can see the benefits towards them.
Yeah, well, I am not someone who is wearing earplugs during the day. I only wear earplugs in my sleep when there is someone else sleeping with me, just because of the fear that if I hear them breathing too much, I won't be able to sleep. Sometimes even so, my dog wakes me up. But yeah, I think I see your point and I get it. And it's something that it got into my head as well because at some point I started sleeping with earplugs even when I was by myself.
Really?
So I realized, okay, I think now I'm more overprotecting myself. I need to just ensure that I make use of earplugs in, in balance with what's going on. So I can use them when it's necessary, but maybe I shouldn't really use them when it's not necessary. So I agree with you. I think any coping mechanism in excess use can become a little bit destructive, a little bit almost addictive.
Yeah.
So it is very important, but I think I agree that it's not a solution. It's basically taking paracetamol when you have a headache and not looking for the reason why you have the headache. But it's actually a great tool to have, I think, especially in places where you have nowhere to go. To me, I I think that it's absolutely okay not to have earplugs or headphones when you are somewhere where you can practice your skills, your CBT skills, but you can leave if you can't really take it anymore. But if you're in an airplane, a train, a boat, like if you are traveling somewhere, if you're somewhere that you can't really leave, I think having that as a safety net, let's say,
Yeah.
it, it's life changing to me.
It's something that we discuss in therapy as well, like you were saying about sort of like normal use. And
Mm.
so some of my patients will say, oh, wear earplugs on the, or like wear headphones on the bus. And it's then sort of crossing into, okay, is this a safety seeking behavior, or is this something that is a normality sort of within everyday life? If I was to take the bus, I would have headphones in because I'd be listening to a podcast. So it's that sort of constant balance, isn't it, of going, right, okay, is this complete avoidance of sound, or is
Mm.
this something that is actually benefiting me in whichever way? We've
Mm.
actually had another question from Howard in regards to the earplugs. He says, I use custom earplugs and the flimsy over the head earphones during an MRI, and it was still horrible. Could you apply the wax earplugs over the custom because I need MRIs once a year?
Oh no. Well, that's something I can't really say, but I'm pretty sure that you can't. I think, Joanna, maybe you are more.
No, with I mean, Obviously, you could have wax earplugs or custom-made earplugs and noise cancelling headphones, but obviously it depends on what they're made of if you're going into an MRI machine. If it's more comfortable, because I know MRI machines are extremely loud.
Very loud.
Some of depending on where you're having the scan done, sometimes they allow, am I right in saying they allow music and different things like that to help calm patients and distract themselves from the sound? So that could be a possibility. If you're not sure, or if you are interested in what sort of type of noise cancelling headphones would be best, I would contact the radiology department where you're having the scan just to get all that information before the appointment. They're really used to having patients who struggle with the sounds or struggle with the small spaces. So, they'll be happy to help and give you that information.
Right.
That's brilliant. Thank you so much for joining us this evening. I really appreciate it. The talk was brilliant. And even considering that, it's amazing when you do something every day that you're still learning more because of a different person's perspective and the research that you have done yourself. So thank you, because I've learned a lot today as well.
I'm very happy to contribute to the learning of misophonia, and I'm very happy that I was invited in this talk, and hopefully I will join as in the audience in a future talk. So yeah, very happy to be here.
Excellent. Thank you so much for that.
Thanks so much.
And to everyone who's still here, I just wanted to say, if you have had any problems with any of the issues that we have raised today, or actually Harris just made another comment. He said, in an MRI, there's also bone conduction of sound where your head rests on the stretcher, which will be made worse by earplugs. Yes, it will. And obviously, unfortunately, some patients who have tinnitus don't like wearing earplugs as well, because it can actually amplify their tinnitus sound. So Howard, I would recommend contacting your radiology department just so that they can give you some other information about how to make you as comfortable as possible if you're having to have regular MRIs. If you feel like you need any additional support or have any questions, please feel free to get in touch with Hashim International. Our website provides lots of interesting resources, not just for patients, but for families and healthcare professionals. The main aim for Hashim International is to provide private consultations and clinics, and we deliver specialist care for children and adults with misophonia, tinnitus, and hyperacusis, and we aim to be able to do this anywhere in the world. We offer a premier therapy package, which combines targeted cognitive behavioral therapy, which Irini discussed in her presentation today, combined with consultations with multidisciplinary team. So we're made up of audiologists, psychologists, occupational therapists, and neuroscientists. And evaluated research, as you've shown in your presentation as well. So I appreciate that. It shows that there can be good results in helping patients manage their symptoms and significantly improve their quality of life. The website also has a wealth of resources and information for families and patients. You can explore case studies with past patients, watch research videos, read blogs from patients living with sound sensitivity. The information is also useful for healthcare professionals wanting to learn more. And there's also access to the research institution information and education and training on the website. If you feel like CBT for you is for you, you will find our number on the website, and we can arrange a consultation with one of our audiologists at a time that best suits you. Thank you, everyone, for watching our first live patient education program. We will see you next month, where we'll be exploring pain hyperacusis in more detail. Thank you so much.
Thank you.
Excellent. I think that is, we're not live.